It's more than 10,000 miles from Washington to this washing line. Yet it was funding that came from the US capital to a South African charity called GRIP, which helped save Bungi, a survivor of domestic abuse.
GRIP helps so many ladies, because even I went there, it was full there. There was kids, mothers, it was full. And I think someone just helped GRIP. I don't want to see GRIP another day falling down. Yeah.
GRIP is a program that was 52% funded by USAID and the PEPFAR Fund for HIV and AIDS. The money was for the prevention of violence and HIV transmission and to support women like Bungi. And these are the faces, the real people, affected because of the worldwide, overnight cut by the Trump administration of these funds. The day we got to GRIP outside Johannesburg, they'd been forced to lay off 21 staff.
It's crazy how our communities are really going to suffer from this. I don't know what we're going to do.
Even today, I admitted a lady. She slept on the street last night.
Oh, it's terrible.
But for us today, now she's safe, she's here, so it's bad news.
And from that shelter, we were taken to the police station where GRIP has trauma rooms.
We've tried to create like a nice, peaceful space, made it quite colourful so that it's much easier for people to come and report gender-based violence at the police station. They don't have to stand in a queue outside. They can come straight to the care room and report anything that they need to report to us in a nice, quiet, confidential space.
And apart from the police stations, they have trauma rooms in 5 local hospitals which are now at risk, and the prevention program has been terminated.
It's very difficult to tell a rape survivor that, unfortunately we've lost funding and so you no longer have access to your social worker. How do you do that? So funding can stop immediately, but certainly the type of work we do, we cannot just suspend activities with immediate effect because we're assisting people and these people are humans and they need us.
South Africa was one of the largest recipients of the PEPFAR Fund set up by President George W. Bush, helping turn the tide of a disease that had wreaked havoc in this country.
There is no doubt that PEPFAR has had a profound impact on this pandemic and, in my opinion, has made America great. The place we were in 2000 when PEPFAR was born as a response, it would be such a tragedy if we went back to anything like that again.
Already services are disappearing. This clinic closed overnight. In Johannesburg, one doctor told us HIV testing has largely collapsed. There is still such a sense of disbelief that this has happened, that these services were closed down overnight with no notice. And while the Trump administration has made it very clear that this is about putting America's needs first, one international aid agency said to us the short-sightedness of that is that these diseases, HIV, TB, malaria, polio, Ebola, they don't just stop at country borders, they get on planes. An HIV vaccine trial funded by PEPFAR has closed, and while in this community pharmacy they're trialling pre-exposure prophylaxis PrEP services and it's looking good, people are coming to get their pills, what will happen when they're ready to roll it out? Will the infrastructure even be there?
The message to the South African government is we need a plan, and the plan is not simply grit your teeth and absorb this into current services. We need much more than that. When it comes to HIV, we are doing superbly. That will disappear. And HIV has gone from the biggest killer of men and women in the country to about number 7 on the list. We will go straight back to number 1 in the next year. And with it, TB will go up, maternal mortality will go up, and infant mortality will go up.
And how will the loss of these services even be counted? The Kumbulani Centre in Cape Town is a programme for HIV-positive children and young people. These workers are now all unemployed.
I have now not been able to pay some of my bills that I needed to pay, as I am the breadwinner in my household.
We are giving hope to the community
Now we don't have hope ourselves. So how do we render a service whereas we don't even have hope for ourselves?
So you're keeping in touch with them anyway?
Yes, always and the WhatsApp. Always give them hope that they're gonna see me one day, but I don't know.
Are you really upset?
Yeah.
They took us to Mfulani, one of the most dangerous townships in Cape Town. This is where the children they cared for live. And we met one, a young girl, HIV positive. She wasn't taking her medication or going to school. That changed because of the charity. Now it will be undone.
I miss you.
Yes, it.
I love you.
I love it.
Always.
I've always.
The American government has said this is about its economic interests and ideology and have referred to rooting out waste and blocking woke programs. But this wasn't just a trim of the budgets. It was cuts so severe, some will never recover. So that USAID official who was put on leave has put out a third memo in which he goes even further. He talks about 17 million pregnant women potentially not accessing life-saving care, 1 million children suffering from severe malnutrition, and he put the blame firmly at the top of the political leadership. Now here in South Africa we've been waiting for a response to all of this, and today the Health Ministry met with charities and NGOs and they said yes, it is time for South Africa to stand on its own 2 feet, that this has been a wake-up call. But of course this is a country that hasn't been able to set its own budget, that there's a row within the coalition. So they said right up, yes, we're going to have to go and talk to the Treasury, but that they did see the benefit now, although sudden, of having to deal with this issue. There are other countries in Africa that are in a much worse state, and we have yet to hear exactly how they're going to deal with these very severe cuts.
Victoria McDonald in Johannesburg.